Despite so many technological advances, the prediction of heart attack and sudden cardiac death still remains an enigma in the scientific world. So-called major risk factors like high blood pressure, diabetes or family history or bad cholesterol suggest that there is only 2 to 3 times higher incidence of heart attack when these risk factors are present in an individual. On the other hand, the recently introduced CT angiogram test, wherein you can have the calcium score and also CT coronary angiogram picture, suggests that if the calcium score is more than 1000, the risk is almost 35 times more than the normal. That means of all the available tests now, that is treadmill test or exercise thallium test or so-called radionuclide tests, this is comparable if not better and very easy to conduct the test, that is less than a minute. So, it is going to be a future gatekeeper for invasive coronary angiogram, wherein you do not need to puncture the artery when you do the CT angiogram and you can preserve the artery. So, either by hand or leg, you do not need to do the invasive angiogram in almost 70% of the patients. So, this is going to occupy a very important role in estimating the risk of heart attack. If the patient has got all 3 vessel disease or high calcium score in CT coronary angiogram, the risk is very high, and based on this degree of stenosis, you can predict whether it is 2 times or 10 times or 20 times or 30 times, so that adequate care and precautions and treatment can be given to the patient to reduce the incidence or at least to catch the disease when the symptoms worsen. It is the fastest CT scan, so that the image capturing is very clear of the coronary arteries. Added to that, it has got 80% less radiation to the existing CT scan machines. This is one of the greatest advantages, and you can capture the image within less than a minute. So, this is a very important investigation tool in predicting the future heart attacks and coronary artery disease, so that we can address the problem when we catch it early.